Hello again, everyone. My name is Marty Guthmiller. I'm CEO at Orange City Area Health System, bringing you today on September 11, our 54th edition of the COVID-19 Community Briefing. As it is the end of the week briefing, we do not have a local scoreboard. We will plan on bringing that to you next week. So we'll jump right into Sioux County and the numbers there. 1,043 positives in Sioux County out of 6,112 tested. That is a 17.1% positivity rate as compared to our previous times of 16.8, 16.3, and 16.1. As has been our practice or our experience, 82% of those positives are in the age group of 60 and under. So that is good news. I'm going to give a little bit of a shout out to our most vulnerable population, or those 61 and over, and say congrats on doing a good job for adhering to social distancing, wearing your mask, doing those kinds of things that have kept that rate as low as it is. So we're going to talk a little bit more about that in a few minutes. I'm going to jump into the percent positive 14-day average. And the good news, if you can classify it as good, is that our percentage dropped from 21.1 to 20.7. So that number did go down. However, the not so good news is that it's the highest in the state. And so Sioux County, as of this morning, as of at least a few minutes ago, has the highest 14-day positivity rate in the state. Lyon County is number 2 at 20.4. Plymouth County, by the way, is number 4 at 17.6. You try to find silver linings where you can, and this is the legit one, I think, although not as applicable to Sioux County. Is 21 counties in the state now of Iowa are at 10% or more. That number previously when we spoke was 25, and the number before that was 32. And so the number of counties with double-digit percent positives in the 14-day average is clearly going down. Ours is going down as well. It's just not going down as fast as others. We're going to talk again. Positivity rate is one thing. Acuity level is another. We're going to talk about that again some more in just a few minutes. One of the key variables in that, of course, is hospitalizations. Region 3, which had experienced a jump in hospitalizations, now has gone down a little bit. So we're at 43 in the 20 counties in Northwest Iowa. That number, when we spoke last Tuesday, was 52. So it's dropped from 52 to 43 this week. The number of patients in the ICU has dropped as well in Region 3 from 12 to 10. And there have been 6 patients admitted in the last 24 hours in Region 3. At the state level, we have 70,914 positives, so almost 71,000 now, of 674,090 tested. That's a positivity rate of 10.5, which is the same as it was on the last time we spoke at 10.5, and the time before that was 10.3. Hospitalizations in the state of Iowa, and I talk about just those hospitalized in the state, are at 295. I'm sorry, it was 295. It is currently today at 282. So we did have a drop this week of 13. Breaking it down a little bit closer to home, getting closer to how does acuity affect the positivity. And I understand there's a lag time, but again, our numbers haven't changed that much over the last couple weeks in terms of positivity rate and acuity, hospitalizations anyway. So Sioux County is as of today at 6. And what that means, again, as a refresher, is that there are 6 Sioux County residents hospitalized somewhere. not just in Sioux County Hospital. So that could be in Sioux City, could be in Sioux Falls, could be in Sheldon, could be in Lamar's, that could be anywhere, but 6 Sioux County residents. That number was 5, so kind of held serve this week so far in that number. O'Brien County is 1. That number previously was 5. So we actually had quite an improvement, 5 to 1 this week in O'Brien County. Lyon County is 1. That number before was 0. Plymouth County is 2. That number before was 6. So again, a nice drop there. Woodbury County is 14. That number when we spoke last was 22. So there's been some nice drops in our area. Again, Sioux County went from 5 to 6, so a little bit of an increase there, but relatively minor. Polk County in Des Moines is at 48 as the number 1 county in Iowa. They were previously at 43. Unfortunately, we've had more deaths this week, 34 since Tuesday. Again, those are COVID-related deaths, not necessarily caused by COVID. There is a difference there, but COVID-related deaths, 1,208. Again, plus 34 this week. Sioux County remains at 3, no change. Lyon County 3, O'Brien County 8, Plymouth County 20, and Woodbury County 58, just as a little bit of a numbers around the region. I don't ever want to be complacent talking about deaths, but we do need to keep it in perspective as well in terms of the population affected, both in number and age. Every death is a tragedy, and I just want to report those numbers as fairly as I can. I'd like to talk a little bit now just about mask wearing as an example, and I think there's a misconception that Marty is anti-mask. I'm certainly not. I understand the role that masking has. It's a significant role. I also understand what masking does not do. It does not make one bulletproof. And so one of the issues that you have to guard against in wearing your mask, and you should wear a mask when in public, is not thinking that you're bulletproof, meaning that I can violate all of these distance things and hang around with people in close proximity and do all that. Yes, masking helps, but it does not make you bulletproof. And so be cautious of that. Be also cautious not to touch your mask all the time, because in doing that, it contaminates it. And so you want to put it on, keep it there, not mess around with it a lot, which is hard to do, quite frankly. I'd also like to encourage everyone listening to find a way to reach out to somebody who may be in a vulnerable age group, and somebody old like me, maybe a neighbor, maybe a colleague, friend, whatever, and just check on them and see if there's anything they need, because while mask wearing is part of the solution and certainly something we should adhere to, we can't ignore the impact of isolation. And in some cases, isolation is greater risk, mentally, socially, psychologically, all those kinds of things. And so sometimes reaching out to that neighbor who maybe has been sheltering in place, maybe isn't able to go to the grocery store, that kind of thing, be on the lookout for someone who may be in need and be proactive, excuse me, in keeping the most vulnerable safe. So just a little bit of a plea there. Sorry, I have a frog in my throat all of a sudden. So, excuse me. One other thing that I'd like to point out, and this is under the category of keeping your engine tuned. I've talked about that a lot. I recently came across a study, and if you saw my office, you would know why I can't put my hand on it right now. But it's a legit study. I can't remember exactly where it came from, but it wasn't it was a legit study that really discussed the impact of obesity on the efficacy or the impact of COVID. And, we've talked about obesity in terms of its impact on diabetes and hypertension and things like that. And certainly hypertension and diabetes are contributing to when people really get sick from COVID. But obesity just in and of itself is multiple times more impactful to the presence of COVID, that your body can't respond the way it should respond. And so another shout out to some fitness things: take a walk, check in on your eating habits, watch that blood sugar level, your hypertension, just keep that engine tuned. I think more than ever, studies scientifically are showing that what we really felt in our guts all along is that the healthier one is, the better equipped they are to deal with things such as COVID-19. It's being proved. And so just another plea for that, and remember to keep that engine tuned. Along with that, continue to control what you can control. Wear that mask when you're out in public. Live your life and enjoy each other. So thank you for joining us today. Again, have a great weekend. Stay strong, stay vigilant, and of course, stay healthy. Thank you again.